100 years ago, the United States was a country coming of age. Henry Ford's Model T was transforming the way that Americans traveled. The Titanic was preparing for its ill-fated maiden voyage to New York City. And the United States would soon be fighting in its First World War. But back home, the nation was waging another important battle: the public health fight against tuberculosis. At the turn of the 20th century, and for decades to come, tuberculosis, an infectious disease of the lungs, would become the leading cause of death in the United States. TB, also known as consumption or the White Plague, was a disease as terrifying to the population back then as cancer is today. Scientists believe that TB was first brought and spread throughout the United States by the massive influx of European immigrants in the late 19th century. Some scientists have theorized that TB was a strong contributing factor in the flu epidemic of 1918, which killed between 20 million and 75 million people, or 1 to 4% of the world's entire population. Leading the battle in the United States against this dangerous disease more than 100 years ago were public health officials from Southwest Ohio.
Well, actually, Cincinnati is the home of the first publicly funded TB sanitarium in the United States. That was what came to be called Dunham Hospital over on the west side, which is now, I believe, Dunham Park.
The city of Cincinnati originally purchased this farmland in 1879 to create an isolation hospital to treat patients with contagious diseases. At the time, health officials were more focused on smallpox than TB, but that would soon change.
Cincinnati had a real problem with TB. They converted that hospital to a TB sanitarium in the late 1800s, I believe, and it wasn't closed until 1971.
This facility, then known as the Branch Hospital, grew from 2 buildings with a total capacity for 75 patients in 1897 to 14 buildings spread over 100 acres less than 25 years later. By the 1930s, the Cincinnati Hospital, now known as the Hamilton County Tuberculosis Sanatorium, had upgraded and modernized its facilities to house and treat 635 patients.
So in the early times when Dunham was open in the early 1900s, TB was treated by isolating people who had it, making sure they got plenty of fresh air. People would sleep on the sleeping porches at the TB sanitaria. They were given very high-calorie diets to combat the weight loss that's typical of active disease. It wasn't really until the 40s that we had effective antibiotics.
Members of the medical staff and other employees lived in dormitories on the hospital campus, which included dining and recreation facilities, treatment facilities, administrative buildings, power plants, and garages.
It was a very busy sanitarium. It was a segregated facility. There were white men, white women, black women, and 4 physicians for adults, and there was a pediatrician there also. I've talked to some patients now who remember being there as children, and apparently they were kept in cribs. Even if they were old enough to run around, the feedback I got from one woman is that my feet never hit the ground the whole year I was there. So I mean, at the time, I think there was a more paternalistic attitude toward taking care of children anyway.
It was regarded as one of the best TB hospitals in the country at the time. At its peak, the sanatorium employed 16 physicians, 115 nurses, 12 technicians, 7 administrative employees, and 245 other employees. In 1945, the hospital was renamed the Dunham Hospital in honor of Dr. Henry Cannon Dunham, a pioneer in the field of radiology and national leader in the fight against tuberculosis. He served as the hospital medical director for more than 30 years without pay. By the 1950s, with the discovery of antibiotics that effectively treated the TB bacteria, and after a widespread public education and mass X-ray program, TB cases began to decline, as did the patients being treated at Dunham Hospital. In 1971, hospital trustees voted to close the hospital, and the county established a new TB control program. Today, the land that began the country's first public TB hospital is now a sprawling recreational complex known as Dunham Park. The park serves many of Cincinnati's families, including the children, grandchildren, and great-grandchildren of many of the people who were treated or worked at the hospital. While many of the hospital's buildings were razed in the 1970s to make room for the park, some of the buildings still remain as part of the complex, a silent reminder of the dreaded disease that plagued our country more than 1 century ago, and of the many public health employees who dedicated their lives to fighting the disease.